More than 60% of adults over the age of 60 are living with at least one chronic condition that was detectable weeks, sometimes months, even years earlier through signs they saw every single day and simply did not know how to read. Not because those signs were hidden, not because the technology to understand them is complicated, but because one of the most reliable early warning systems your body has is sitting right at the tips of your fingers, and almost nobody is talking about it the way it deserves to be talked about. Your nails. The ones you probably trimmed this week. The ones you glanced at this morning while pouring your coffee without giving them a second thought. They are not just there for appearance. They are not just keratin growing out of your fingertips. They are alive, continuously updating readout of what is happening inside your cardiovascular system, your kidneys, your liver, your lungs, your blood, and your blood. And after the age of 60, that readout becomes significantly more important because the conditions these nail changes point to are exactly the ones that tend to arrive quietly, without dramatic symptoms, sneaking up on you over months and years until they are no longer quiet at all. Here is what most people do not realize. The connection between nail changes and systemic disease is not new science. It has been documented in medical literature for decades. But in the average 10 to 15-minute doctor appointment, there is only so much ground a physician can cover, and nail examination, unless something is visually alarming, rarely makes the priority list. So the information exists, it just does not always make it from the clinical setting to the person who actually needs it most. My name is Dr. Michael Williams, and I have spent years focused on preventative health and the very specific ways aging affects the body after 60. What I want to share with you today is something that does not get nearly enough attention, even though the clinical evidence behind it is remarkably well established. In this video, I am going to walk you through 7 nail signs that can point to serious underlying conditions, and I am saving the most important one for the very end because it is the one that consistently surprises people the most, and it is the one I most want you to know how to recognize. Before we get into the signs, let me explain what is actually happening beneath the surface. Each nail is composed primarily of a protein called keratin, and it grows from a structure called the nail matrix, that crescent-shaped area just beneath the base of your nail. The cells in that matrix are constantly dividing and pushing outward, and as they do, they carry with them a record of your internal environment at the time they were formed. Think of it like growth rings in a tree, except instead of recording rainfall and drought, your nails are recording blood oxygen levels, protein status, circulation quality, and systemic inflammation. For someone in their 30s, the body has enormous reserves and compensatory mechanisms that can mask a lot of internal dysfunction, which means the nails may not reflect anything alarming, even when something is beginning to go wrong. But after 60, those compensatory reserves are thinner. Not because the body is broken, but because it has been running for 6 decades, and the margin for quiet dysfunction narrows considerably. What this means practically is that nail changes in someone over 60 carry more clinical signal than the same changes in a younger person. Your doctor is not necessarily looking for them because in a busy practice, they are triaging for the most urgent visible concerns. But that does not mean the signs are not worth knowing yourself. Let us go through all 7 signs. I want you to listen through each one because several can appear together, and recognizing a combination is often more clinically meaningful than any single sign on its own. The first sign is clubbing of the fingertips, and this is one that many people either do not notice or chalk up to just the way their fingers look. What clubbing refers to is a gradual bulging of the fingertip tissue beneath and around the nail, giving it a rounded, almost downward curving appearance, like a drumstick or the back of a spoon turned upward. If you look at a normal finger from the side, there is a visible angle between the nail and the skin at its base. In clubbing, that angle disappears or reverses. The fingertip puffs upward beneath the nail, and the nail curves over it. What is happening here is a change in soft tissue and bone related to chronically low oxygen levels in the blood. Research has documented strong associations between nail clubbing and conditions including chronic obstructive pulmonary disease, heart failure, lung cancer, and certain gastrointestinal diseases. The reason this matters so much for people over 60 is that clubbing tends to develop incredibly slowly, over months and years, which means it can be completely normalized by the person experiencing it, because each individual change is so gradual that it never triggers alarm. I want to share a pattern I have seen repeatedly. A patient attributes the rounded appearance of their fingertips to arthritis or aging for years. It is only when a family member notices the curve of their nails in a photograph, or when a new doctor happens to observe it during an examination, that the question gets asked. And what follows is sometimes a diagnosis of early-stage pulmonary fibrosis, a heart condition, or another illness that could be monitored and managed much more effectively because of how early it was caught. If you look at your fingers from the side right now and notice that the angle between your nail and the skin at its base has flattened out, while the fingertip tissue seems puffed upward beneath the nail, that is absolutely worth bringing to your doctor's attention. A simple test you can do yourself is called the Schamroth window test. Place the nails of your two index fingers together, back to back. In normal fingers, you should see a small diamond-shaped gap between the nail beds where they meet. If that diamond disappears and your nails press flat against each other, that may indicate the beginning of clubbing. The second sign is called Terry's nails, and this one surprises most people when they first learn about it because it is so easy to miss. Terry's nails appear mostly white across the surface of the nail, with only a narrow pink or brown band near the tip. The nail bed loses the healthy pink tone that comes from blood flowing through the capillaries beneath it, and instead looks pale, almost opaque, like frosted glass. What is happening biologically is that the vascularization of the nail bed is being altered. The tiny blood vessels that give the nail its normal pink color are changing in response to systemic disease. Research has found strong associations between Terry's nails and conditions including liver disease, congestive heart failure, type 2 diabetes, and in some cases, chronic kidney disease. The reason this matters, particularly after 60, is that all of these conditions tend to become more prevalent with age, and many of them develop silently, without pain or dramatic symptoms, for a very long time before they are detected through conventional testing. The pattern I see in practice is that a patient comes in for a routine checkup and happens to mention that their nails have always looked a little pale. A basic metabolic panel reveals significantly elevated liver enzymes, or an early indicator of heart failure, or blood sugar levels that have drifted into the diabetic range. The nail change was the visible clue that prompted the investigation. If your nails look white or whitish opaque across most of their surface, and that has been going on for some time, it is genuinely worth mentioning at your next appointment. Do not assume it is cosmetic or normal. The third sign is something called Lindsay's nails, also referred to as half and half nails, and it is distinct from Terry's nails in a specific and clinically important way. In Lindsay's nails, the lower half of the nail, the half closest to the cuticle, is white or whitish. The upper half, closest to the tip, takes on a darker color, often brownish or pinkish red, creating a visible horizontal line across the middle of the nail that divides it into two distinct zones. What is happening here is believed to involve melanin deposition and changes in nail bed vascularity that are closely associated with chronic kidney disease and kidney failure. And the reason this is so significant for anyone over 60 is that kidney function naturally declines with age, and chronic kidney disease is one of the most underdiagnosed conditions in the older adult population. The kidneys rarely cause pain in their early stages of dysfunction. There is no alarm signal that most people would recognize as kidney-related. You might feel a bit more tired, retain a little more fluid, experience slightly more shortness of breath, but none of these symptoms point obviously to the kidneys. If you notice a clear horizontal division across your nails, lighter at the base and darker at the tip, and you have any history of diabetes, high blood pressure, or cardiovascular disease, that is something to discuss with your doctor, specifically in the context of kidney function. A simple blood test measuring your GFR can tell you whether your kidneys are filtering at the rate they should be. The fourth sign is Beau's lines. These are horizontal ridges or grooves that run across the nail from side to side. They look almost like someone pressed a shallow indent into the nail while it was forming, creating a visible ridge that you can feel with your fingertip when you run it across the nail surface. What happened is that nail growth was temporarily disrupted. The matrix cells stopped dividing normally for a period of time, and the ridge marks where that disruption occurred. Research links Beau's lines to a wide range of physiological stressors, including severe illness, high fever, major surgery, chemotherapy, significant nutritional deficiency, and uncontrolled diabetes, because all of these events can interrupt the cellular division process in the nail matrix. For people over 60, this matters because Beau's lines can sometimes indicate that the body experienced a significant internal stress event that the person was not fully aware of, or they can confirm that a chronic condition like diabetes is not as well controlled as previously thought. The lines also give you a rough timeline because nails grow at approximately 3 millimeters per month. So a line located halfway down the nail suggests the disrupting event happened roughly 3 to 4 months ago. Here is the detail that surprised me when I first started paying close attention to this. Beau's lines, in someone who has not been overtly ill, may be an early indicator of poorly controlled blood sugar. Multiple parallel ridges, suggesting recurring disruptions, are worth investigating alongside your most recent A1C or blood sugar history. Bring this observation to your doctor. The fifth sign is koilonychia, more commonly called spoon nails. And this one has a look that is hard to miss once you know what you are looking for. Instead of the normal slight downward curve of a healthy nail, spoon nails become concave. They curve upward and inward, so that if you were to place a drop of water on the nail, it would actually sit in the depression rather than run off. What is happening is a change in the nail structure associated with iron deficiency anemia. Research suggests a strong connection between spoon nails and low ferritin levels, which is the stored form of iron in the body. For people over 60, this is especially relevant because iron deficiency anemia in older adults often has an underlying cause that goes beyond simple dietary insufficiency. It can be a sign of chronic blood loss from the gastrointestinal tract, which can in turn be related to conditions ranging from ulcers to colorectal polyps to early-stage colorectal cancer.
The nail change, in other words, may not be about the iron itself. It may be pointing to something upstream of the iron that is causing it to be lost or not properly absorbed. I have seen this pattern play out in practice. A patient notices their nails have been scooping for several months, but assumes it is from wearing tight gloves or from normal aging. A routine physical includes a complete blood
Blood count that flags anemia. A subsequent colonoscopy finds and removes precancerous polyps that would otherwise have gone undetected for another year or two. The nail was the first domino. If your nails are curving upward or appear concave, get your iron and ferritin levels checked. And if those come back low with no clear dietary explanation, make sure your doctor investigates the cause, not just the deficiency itself. The sixth sign is splinter hemorrhages, and the name describes exactly what they look like. These are thin, dark reddish-brown lines running vertically under the nail, resembling tiny splinters trapped beneath the nail surface. They form when small blood vessels in the nail bed rupture and leak. Now, a single splinter hemorrhage after an injury or impact is usually nothing to be concerned about. That happens to everyone occasionally. But multiple spontaneous splinter hemorrhages appearing on several nails simultaneously, especially without any trauma to explain them, are a recognized clinical sign of a serious condition called infective endocarditis, which is a bacterial infection of the inner lining of the heart. Research also links splinter hemorrhages to vasculitis, inflammation of the blood vessels, and certain autoimmune conditions. The reason this matters so acutely for anyone over 60 is that infective endocarditis, while relatively uncommon, is a life-threatening condition that progresses rapidly if untreated, and it can present with surprisingly subtle early symptoms. Fatigue that you attribute to a busy week, a mild fever that comes and goes, joint discomfort that seems like arthritis flaring up. None of these symptoms scream cardiac infection, but splinter hemorrhages on multiple nails, combined with any of those vague symptoms, especially after recent dental work or a medical procedure, which are known entry points for the bacteria involved, should prompt immediate medical evaluation. This is not a wait-and-see situation. If you see multiple spontaneous dark vertical lines under your nails, contact your doctor promptly. And the seventh sign, the one I saved for last, is yellow nail syndrome. I told you at the beginning that this one consistently surprises people the most, and here is why it earns the final position. Yellow nail syndrome involves nails that have taken on a distinctly yellow or yellowish-green color, have grown extremely slowly or stopped growing altogether, and often become thickened, hardened, and curved, sometimes detaching partially from the nail bed. What is happening here involves a condition where the lymphatic drainage system, the network that moves fluid, immune cells, and waste products through your body, is not functioning properly. Research has found that yellow nail syndrome is associated with chronic respiratory conditions, including chronic bronchitis, bronchiectasis, and pleural effusions, which is a buildup of fluid around the lungs. It is also associated with lymphedema, swelling due to lymphatic dysfunction, and in some cases, certain internal malignancies. This sign deserves the final position because it is the one on this entire list that most consistently points to multiple, simultaneous systemic problems. It is not a marker of one condition. It is a marker of a body dealing with compounding dysfunction across several systems at once. Most people assume yellow nails are a fungal infection, and that is certainly a possibility that should be ruled out first. But what surprises people is that when standard antifungal treatments fail to resolve the yellowing, or when the yellowing is accompanied by very slow nail growth, thickening, a persistent cough attributed to allergies, and mild swelling in the lower legs attributed to standing too long, the clinical picture changes considerably. When all of those symptoms are presented together to a physician, they often point to a diagnosis that requires comprehensive workup, not just another tube of antifungal cream. The takeaway is this. If your nails have been yellow for a long time and have not responded to standard fungal treatment, especially if you also have any respiratory symptoms, persistent swelling, or unexplained fatigue, that combination needs a thorough medical evaluation. Now that we have covered all 7 signs, let me give you a practical framework for what to do with this information. Because knowing something and acting on it are 2 different things, and I want to close the gap between them for you. Start today by doing something simple. Examine both hands under good natural light. Look at the color of your nail beds. Are they pink and healthy, or pale, whitish, or yellowish? Look at the shape. Are your nails flat, slightly curved downward as normal, or are they concave, bulging, or thickened? Look for any horizontal lines or ridges running across the surface. Look for dark vertical streaks under the nail, and note any change in growth rate you may have noticed over recent months. Take a photograph of your nails today. Having a visual record gives you a baseline for comparison. If anything changes over the coming weeks or months, you will be able to see it clearly rather than relying on memory. This week, if you see anything from today's list that seems consistent with what you observed, write it down. Note the sign, which fingers are affected, and roughly how long you have noticed it. Bring that written note with you to your next doctor appointment. Having it documented means you will not forget to mention it in the middle of a busy visit, and it gives your doctor the specific detail they need to determine whether further investigation is warranted. If you have any of these signs and do not have a scheduled appointment in the near future, consider calling your doctor's office to ask whether a nurse can do a quick phone assessment. Describe what you are seeing, and let them help you determine whether it warrants an urgent visit or can wait for a routine appointment. And most importantly, please do not diagnose yourself based on any single sign in isolation. What matters is the full picture, including your medical history, current medications, recent changes in your health, and what your doctor finds on examination. Today's video is designed to make you a more informed participant in that conversation, not to replace it. I want to leave you with this thought. Your body is extraordinarily communicative. It has been sending you signals your entire life. And the remarkable thing about being over 60 is that you have more context, more experience, and more access to medical support than at any other point in your life. The 60s, the 70s, and beyond are not a time when meaningful health action becomes impossible. The research consistently shows that early detection and informed attention to signals like these can alter outcomes dramatically, even in later decades. The nails you looked at this morning and maybe dismissed as nothing interesting may be the most accessible diagnostic window your body has given you. You just needed to know how to read them. And now you do. If you found this video helpful, please subscribe to this channel. I share new content every week designed to help seniors recognize the signs their bodies are sending and take action before small problems become serious ones. And if someone you care about, a spouse, a sibling, a friend, could benefit from knowing these 7 signs, please share this video with them today. Early awareness is the most powerful medicine there is. I am Dr. Michael Williams. Thank you for watching, and I will see you in the next video. Check your nails and take care of yourselves.